First, we will hear from Rex Archer. Dr. Archer is Director of Health for the City of Kansas City, Missouri, past President of the National Association of County and City Health Officials, and is currently an Executive Committee member of the Public Health Accreditation Board. As a medical doctor, he has the challenge of protecting the health and safety of 500,000 patients and has been recognized as Health Equity Partner of the Year by Moore Square. Now, Dr. Archer, and he will be using the PowerPoint.
Thank you, Ari. I provided a handout, and there are still some at the back, and afterwards I've got some extra copies. I'm going to run through this very quickly because of the time and the importance of what all the other speakers are going to be saying. So some of this is going to be flashing fairly quickly. Next slide. Recently, as Oprah was reminding us of the importance of this movie, Selma, she talked about there's no time to learn from our past like now, the moment right now. Next slide. And one of the most often misquoted quotes in the world is actually one from Martin Luther King. And of all the forms of inequality, injustice in health is the most shocking and most inhumane. If you go back to the original transcript, sometimes health care gets added into that, but Martin Luther King knew that health was much more than health care. It's really a lot of what this panel is about today, all the other factors that impact health. Next slide. So the reason we have government is to solve problems collectively that we cannot solve individually. Next. And we have a definition of public health as what we as society do collectively. And I've added through organized actions to ensure conditions in which all people can be healthy. So all of you, whether you knew it or not, are part of our public health workforce. And I want to thank you for that work. Next slide. I'm going to pass on Bill Clinton's quote here because I've got it in your handout. I wanted to show you life expectancy in Kansas City, Missouri, and the challenge that we have. Slight progress, you'll see. The red bar is the most recent 5-year period. The blue bar was a 5-year period 15 years ago. And you'll see that we've increased life expectancy for each of these 4 groups by 1.2 to 3 years. The bad news is that we still have a very unequal life expectancy across these groups. We are making slight progress in reducing that gap, but not fast enough. Next slide. And this shows by zip code, you'll see as much as a 13-year difference in life expectancy between our longest living and shortest living zip codes. You can get all this access from our health department if you're interested in more of this. Next slide shows the types of conditions on a death certificate, which are really symptoms, because as we are learning, the root causes are other things than what people see on the death certificate. Next slide. So if we look at Kansas City, Missouri, and we look at attributable deaths to social factors, what we find is that approximately 234 deaths occur each year just because folks did not graduate from high school. 561 from racial segregation. And you'll see a number of poverty indicators, not just individual level poverty, but income inequality and community level poverty cause extra deaths. And our best estimates are between 41 and 53% of our deaths in Kansas City, Missouri are from these factors each year. So it's about 1,800 deaths out of our 3,600 each year. Next slide. And shockingly enough, this shows that if somebody's in the age cohort from 25 to 34, they're 17.5 times as likely to die if they have not graduated from high school than if they have graduated from college. 17.5 times. A high school graduate still has 12.5 times as likely to die in that cohort as somebody that's graduated from college. Next slide. So when we look at the causes of determinants of health, you'll see that 40% of that pie are the social and economic factors. In fact, they're 4 times as important as our clinical care, as important as clinical care is. Next slide. And just keep clicking through this because it'll build. You'll see social determinants. Those impact us, create stress and uneven distributions of illness and well-being. Those social determinants come from power, wealth, imbalances. And all of these factors and policies have to be addressed to focus on power and wealth imbalances. And ultimately, those power and wealth imbalances come because our social structures are set up with institutional racialization, class oppression, and gender discrimination and exploitation. So until we face those, we can't actually make the progress we need to make. Next slide. So we've had definitions here. I want to focus a little bit there on health inequity, differences in population status and mortality rates that are systematic, patterned, unfair, unjust, and actionable. These are not random. We cannot blame the individual. These are part of our systems that cause this. Next couple slides, there you go. And health equity is the fair and just distribution of these resources. Next. So all of these social determinants impact how long we live, and if we're not working on all of these, we're not going to make the progress we need to make. Next slide. Well, we do know how to reverse epidemics in public health. Next. Martin Luther King, another favorite quote of his, is that anybody that wants to make the road 1 lane wide is going to cause a traffic jam. And we really need to be working on several approaches. Next slide. One of those is aimed for peace and violence prevention. And you'll see citywide, through a lot of different factors, we had a 3-year average from 2010 to 2013 of 105 deaths, 28% reduction down to the 76. In the area that we have been focusing with Aim for Peace, that we've been funded for from several different sources, the foundation here locally, the Department of Justice, and our health levy, you'll see we've had a 75% reduction from the baseline of 20 homicides per year for 3 years, down to 9, down to 5. Next slide. And that's the target area that we've been working in those police beats. Next slide. So we have a Kansas City improvement plan. I won't go into that. That could be a couple-day seminar to go into all the details of that plan. Our city council in their 5-year business plan has approved this community health improvement plan and the updating of that, as well as the citywide plan now actually says that we want to be focusing on life expectancy and reducing the inequities between zip codes. And that's the first time we've had that as a goal. So public health is a social justice enterprise. I'll keep clicking through this. Yes, justice equals truth plus power. And if you look at this, we bring from a public health perspective the data and the research, but it's community organizing, all the folks in this room, that bring the power so that we can get to justice. Keep clicking through there. And More Squared, CCO, and a lot of other groups we work with. Next. So this is aligned campaigns. This is actually a slide from Catherine Evans and I in a presentation we did in Minnesota for a combined group of public health and community organizers across the Midwest. And these are all campaigns that we could talk about and some successes that have occurred. The City Council unanimously supported banning the box. We've worked together to get bipartisan state Missouri to ban the ban on food stamps, SNAP for felons that had previous drug addictions. All these activities are critical things that we need to be working together. These change the systems. Next slide. So I'll pause there and thank you.